Hello, this is Khabir Southwick, traditional naturopath, Ayurvedic practitioner, and herbalist in beautiful Ojai, California. Subject of our talk today is understanding the different causes of a headache. Many people have come to me or just called me on the phone or emailed me and said, what can I do about my headache? And headache's actually quite a complex condition, and it's often a symptom of a deeper cause. So it's really very difficult to treat unless you know the cause. So without knowing the cause, it's almost impossible to treat the headache. You could guess and to do a few little home remedies by putting your feet in hot water and putting a cold pack on the back of your head, or try drinking some feverfew and white willow bark tea to alleviate the pain, or other analgesic herbs. But you really have to understand the cause and the type of headache that you have to know the treatment. So I'm hoping that this helps you to classify your type of headache, and then if you do email me or contact me, you could tell me the type, and then we could talk about possible treatments. Maybe in the future I'll make another video with all the different treatments. So first let's talk about the different types of headaches from the Ayurvedic perspective, or a doshic headache. This is a headache that's caused by an increase of either Vata, Pitta, or Kapha. Either of these three doshas can contribute to a headache. These are the three main types of headaches. Then we'll address some of the causes. The Vata headache by nature is throbbing, shooting, and vague. It comes during the Vata times of day, which are dawn and dusk, and is more common during the fall season. The Vata headache is associated with constipation, indigestion, and abdominal discomfort. And it's usually in the base of the skull. Of course, muscular pain in the neck and misalignment of the spine can also cause this type of headache, and stagnation of chronic ama, or toxicity or undigested food stuff in the colon, is another cause. And of course, traumatic accident or injury, such as whiplash, can also cause this type of Vata type of headache. A Vata headache is also due to too much exercise or insufficient sleep, and even a change in one's pillow or bed or sleeping conditions. So second type is the Pitta type, and the Pitta type of headache is often due to excessive exposure to sunlight or heat, and is usually located in the temporal area, and is usually caused by hyperacidity and even acid indigestion. A Pitta headache also comes with nausea, sometimes vomiting, can even relieve a Pitta type of headache. The Pitta headache is, by nature, as its qualities are, it's intense, sharp, penetrating, and it makes a person irritable. So we may know somebody who's has this type of a headache. This type of headache is more common during the midday and the midnight, and during the summer season, particularly when the weather is hot. Kapha type of headache is slow, dull, and aching. It's usually located in the front of the head, and it may be associated with a Kapha type of allergies, cold, congestion. Kapha type headache often occurs during Kapha times, which are mid-morning and mid-evening, as well as in the spring. Gravity plays an important role in Kapha headache, so if you bend your head down or do a headstand, the headache is more intense. So that's the first step, is to really first classify your headache into either a Vata or Pitta or a Kapha type, and generally this will follow your Prakriti, your original body type, but not necessarily, and that will help dictate the treatment. Next is to understand the cause. If it's not just a physiological doshic imbalance, which we just covered, it can be an emotional headache. For the Vata type of headache, can be triggered by the emotions of fear, anxiety, insecurity. And the Pitta type of headache can be triggered by anger, hate, envy, judgment, and intense stress. And a Kapha type of headache can be associated with depression, attachment, greed, and possessiveness. So this is still has a doshic imbalance, but the cause is emotional. And then there's pathological headaches, which are the end result of a long pathological process. And this could be due to high blood pressure or even a space-occupying tumor in the pineal or pituitary glands in the brain. And then there's what we call referred headache. And referred headache may be due to tooth or gum infection. And this type of headache will go from the cheeks to the temple area. And also, even an infection in the throat or nose or tonsils can create this type of headache. So a person who has a fever may get this type of headache. Another type of headache, or a cause, we should say, is due to allergies and chemical toxicity and sensitivity. Exposure to toxic chemical substances such as insecticides, disinfectants, or even certain pollens may produce a Pitah headache. Foul air, poor ventilation, carbon monoxide poisoning, some drugs including alcohol and tobacco can cause this type of headache. Many people are sensitive to wine, chocolate, or dark cheese, and these substances can cause this type of headache. Also, eye problems or poor eyesight can also contribute to headaches. Toxins in the liver can disrupt your eyesight in the eyes and create a type of pain where when the eyes are moving, and this would come under the Pitta category. Also, an ear infection can be the cause of a headache. A degenerative bone conditions, such as osteoporosis, for example, can be a cause of a headache. And often we know this by other symptoms such as ringing in the ears. And many metabolic disorders can also contribute to a headache, including poor digestion, absorption, assimilation of food, nutritional deficiencies such as B12 and other vitamins and minerals such as calcium, magnesium, and zinc, which will all create changes in the plates of the skull and cause muscle stiffness, creating a headache. Metabolic disorders that can induce headaches also include hypoglycemia and malabsorption and even obesity. And another type of headache is a systemic headache. This is where there's a dysfunctioning system or sutra in the body that causes a headache. And liver disease, hepatitis, rheumatism, diabetes, severe anemia, all would fall in this category. Gastrointestinal disorders such as hyperacidity, chronic constipation, acidosis, all would also be in this category. These conditions are all associated with the digestive system channel and are metabolic disorders of the digestive fire. Cardiovascular disease such as congestive heart failure, edema may also increase pressure in the vascular system and cause a headache. Well, the endocrine and pituitary tumors can create increased pressure as well. Hormonal dysfunction also can cause headaches. And then there's migraine headaches. This is caused by Vata pushing Pitta from an Ayurvedic perspective, and the imbalance is responsible for disorders of the cranial blood vessels. It will either create inflammation in the arteries or dilation are the arteries, and with visible pulsations in the temporal area, leading to the migraine. Other causes of headache, which are miscellaneous causes, as there's so many, include fatigue, exhaustion, sunstroke, misalignment of the spine, prolonged strain of the neck and the muscles, and withdrawal of any addictive substance, including coffee, also histamine toxicity, carbon dioxide retention, all can contribute to headaches. So It's very important to understand the cause of your headache. And once you understand the cause, what the cause is, and then you look at the type, whether it's Vata, Pitta, or Kapha, then this will dictate the type of treatment and approach and herbs that will help you to address this symptom. A headache, like much pain, is like an alarm system going off in your body, giving you a warning that there's a deep problem and something needs to be addressed. So just taking painkillers or reducing the pain, whether it's with pharmaceutical medications or analgesic herbs, isn't addressing the cause. So I hope this helped you to understand the possible causes of your headache and hopefully identify yours and your type, and then and help you to address it at a cause level. Thank you very much.